Thank you so much, Dr. Baswedan, for such a eye-opening talk. And yeah, I really appreciate that you share your experience as an urban leader, as a governor of Jakarta, which I imagine is a very challenging and very complex task to do. And the fact that this is I think that your first time sharing this, what happened in Jakarta to academic audience is something that we're really grateful. So we still have plenty of time actually for question and answer session. So if anyone want to have any question, comments, critics, feel free to raise your hand. Yes, please. Can somebody share the microphone?
Yes. Let's line up to 3 questions.
Okay.
3 to 4 questions, then I answer.
Sure. So we're gonna for this round we're gonna take 3 to 4 questions first.
Halo, Assalamualaikum warahmatullahi wabarakatuh. Selamat siang, Pak Anies. Good afternoon. My name is Prima. I'm an MPA student from Indonesia. So I would like to talk about the transparency that become your 3 principle for managing the crisis. Okay. In the crisis and that period, I mean, what really made you think that it is the best option to open to the people? Somehow during the crisis, when you open the data, the real data, the fact to the people, somehow it can drive to the chaos, right? In additional, it is also in contrast with what the national government doing. So what really made you think that to be open to the public is the best option at the time? Thank you
so much. We move to the second question from someone in the back.
Thank you. Thank you for the very nice presentation. I really enjoyed. My name is Digonto Das. I'm an associate professor at NIE. This is something related to the context of urban resilience, and you have already talked about the context of urban resilience in relation to Jakarta during pandemic. And I was wondering if you could kindly share a little bit more about Jakarta's kind of context of urban resilience in relation to population, and that's socio-economically lower section of people. I understand that Jakarta has a huge number of informal workers as population, and what kind of support was provided in Jakarta during the pandemic time? Thank you.
Thank you. Next.
Digonto Das. Yeah.
Next questions from the lady. Yeah.
Thank you, Pak Anies. I'm Lily. I'm a doctorate in education student at NTU. It's very interesting to hear you uncover the hurdles that you face, especially during the beginning of the pandemic. And as you mentioned, it happened because of the overarching opinion that goes around at the time that it's better to sort of shut off the reality, which for me might happen like every day in our leadership experience. What I would like to ask you is that how do you deal with that and how do you rise above it? You see the conflicting between the reality and the political opinion that goes around. Yeah, I would like to hear that as leadership experience. Thank you so much.
Great questions. Pak Anies, do we need to take another one or? Okay.
First, Prima, your questions, why you choose to be open in terms of data. Yes, we went through that conversation for practical reasons. Number one, it's about our values. When you are confronted with crisis, your true values will be something that you hold upon. If you're not experiencing a crisis, then it's not your true values. When you experience the crisis, that's the time where your true values emerge. And we thought, and we believe that everyone deserve to know what is happening in a holistic way. And we think it's everyone's right to have that information. That's from the values point of view. The second is more from the pragmatic point of view. If you are dealing with a one-time crisis, you can hide the numbers. But if you're dealing with a repeated crisis for 2 years, you cannot hide the numbers. You just can. If you're experiencing an earthquake, some say 500 people were killed. Some were saying it's 300. And some were saying 600. But the event has passed. Right? But if it is repeating every day for the next 2 years, how can you hide the numbers? If you lied at the beginning, you will be lying next day. You will be lying against next day. Because you have to cover up the untruth data that you presented earlier. And that's the mindset that we adopt. It's going to be long term. There is no way you can lie because they will uncover the truth. That's why we adopted that principles. If we hide those numbers, the statistics, eventually we will face problems. And we do face problems in terms of, not because of, we are facing problems that we thought fortunately we're telling the truth. This is the problems. We're running out of space on our cemetery. The slot that is available, we have many cemeteries. We allocated 2 cemeteries for COVID casualties. And in those 2 cemeteries, the area is full. So we need to open up new cemeteries only for COVID victims in the northeast of Jakarta. It's completely new land being cleared up. Imagine if we didn't go public with initial casualties at the beginning. How do you explain this lack of space for death in Jakarta? But since we did go public and we tell the truth, then over time, people realize that I will trust him. I will trust the government because he's telling the truth. At the beginning, the reaction was, you are exaggerating the problem. I don't like it. You're creating chaos. I don't like it. But over time, as this problem continues, they started to realize I better listen to him because this is the truth. And that's what we tried to build from the very beginning. Yeah. Second questions. When we started restrictive measures of controlling mobility, everyone needs to work from home, studies from home, worship from home. What did we do? We provided supports for families who needs basic needs to be supplied by government. Let me give you an illustrations on the populations of Jakarta. You mentioned earlier, some were living in the low socioeconomic status in I would say neighborhood of that groups in the cities. Jakarta has 11 million people. And we have 3.2 million families. 11 million people, 3.2 million families. 900,000 families were receiving monthly food supplies from government, 900,000 every month on a non-crisis time. During this crisis, we are distributing that 900,000 to all families every 2 weeks. On top of that, we ask head of leaders in the neighborhood, which is Ketua RT, to identify individuals who lost their jobs, who cannot make a living because of the restrictions. And the number increased from 900,000 household into 2.4 million household. Okay? So 2/3 of the people in Jakarta were under our responsibility for their basic needs. And those data were collected by the local leaders. So the process, that 900 is data that we had prior to the crisis. We asked local leaders to add more. And the verification is not from us, the verification is from the community. And they usually don't lie in that community. At times of crisis, they will say, you may have cars, but if you have no incomes, then that car is useless. In the past, if you have a car, you're not recipients of subsidies. But that, during a normal period, if you have cars, you have nice home, and you have income. When economic activity stops, you may have good house, you may have cars, but there is no income coming in. So those without incomes were receiving support, 2.4 million. And I often tell our business community, we did not ask you to provide the monetary support to those who is in need at all. But let me tell you, if government did not intervene and provide that, the city will be experiencing a chaos. Okay? If people cannot eat and households were unable to cook, we are facing chaos. So the absence of chaos is because we intervene immediately. And our state-owned enterprise, which is Pasar Jaya, we're running one of the most massive food distributions ever in the history of Jakarta, in the history of Indonesia. Within 2 weeks, they have to distribute food to 2.4 millions, and the 1.6 millions were new households. The 600 millions were the regular one. It was a massive project. And to distribute the food, the boxes of this food to the communities, I'm asking the army to help us. And when the truck of the army coming into the neighborhood, it's all safe. Everyone wait, because the army is the one who handed it on. And the army is doing it, of course, all is pro bono. This is a humanitarian mission. So it is a collaboration. Our state-owned enterprise prepared that, and then channeling it. Our army is helping on distributing to the local leaders, and then the local leaders distributing to the household. It was a massive project for resilience approach. And that has helped Jakarta avoiding chaos that some cities were experiencing when restrictive measures of mobility is being adopted. So that's behind the scene process. And again, I haven't actually shared this story many times. This is actually the first time we share some of these stories. And I have to say that our challenge in government is often our bureaucrats were worried about making decisions at time of crisis. What they are worried is not about the decision today. What they are worried is about the auditors coming in next year. Okay? Look, you have to decide now, how do you do the procurement? Right? On the other hand, the people needs the food immediately. That's you have to decide. If you do the regular procurement method, it will take that period of time, and then chaos will be there. But if you do a speediest process, the auditors later on will come back to you, you're not following this SOP. And when the audit was done, usually the crisis has already been over. So you're no longer facing the crisis. Same thing. The face covering mask. During the crisis, the price was so expensive. When the audit was done the following year, the price already dropped. And then you're saying, why you're paying this much for a face mask? Not today. And this is lesson learned that leadership of nations will have to adopt to ensure that local bureaucracy is willing to make decision quickly if they are truly protected from issue of governance. So that's just additional topics to add to you. Lily, reality, yeah, it was challenging. It was challenging. Some I will not be able to share today, but I will at some point share. But what is what is happening in our mind during that time? I tell our friends, our teams, let's not worry about what people say today. Let's not worry about what is being written in the news. Let's not worry about what is being written in the social media. Let's think of what historian will be writing in the future. Okay? They will be writing this event with aggregate data, with time series data, and at that time they will judge us with objectivity. And when you are in the pilot seat on a plane, and we know we're coming to a turbulence, we need to inform all our passengers. All passengers, we're entering a turbulence. It will be tough, it will be bumpy, but everyone understand this. And be ready for all the consequences. And when we are sending that message to the public, to the Ministry of Health, all were on records so that we can tell we're trying to do what is right. You know, sometimes I have this diagram in my mind, like an x-axis and a y-axis. The x-axis is right on the top, wrong at the bottom. That's values, right and wrong. And then the y-axis is good and bad, okay? Then you have 4 quadrants here. Good and bad is consequences. Right and wrong is values. In an ideal world, you want to make a decision that is right and good, okay? Right in terms of values, good in terms of consequences. But sometimes, in reality, we're facing situations you have to do the right things, but bad consequences. And sometimes you have to do good things, but wrong. What we have to avoid and don't do it is the 4th quadrant. Okay? It's wrong and it's bad. That's what you want to avoid. But the 3 quadrants, you as leaders, you have to be willing to exercise your authority, to make decision on these 3 quarters. And then you have to explain later on. On one quadrant, which is good and right, you don't have to explain. Everyone will agree. Everyone will agree. But on the diagonal side, some people will agree, some people will disagree. And this is the part where you cannot apply a simple if-then models. If this and that, if this then that, because this requires wisdom, requires experience, requires knowledge, requires, features of leadership. That's where you exercise your authority. So during this crisis, I often, reviewed myself. Whenever I make decision, it falls under which quarter of that. I'm trying to avoid the last one. It's wrong and it's bad. But sometimes you have to do what is wrong but good for the society, and sometimes you have to do what is right but bad in terms of consequences. Just like when you have to do a lockdown, it's the right thing to do. Scientists have been saying that, but the consequences to the general public is bad, because then you don't have incomes. But I am fortunate that if I also share this to our friends in academia, I was exposed to public policy materials when I went to school. And there was a course when I did my master's and PhD. It's called Moral Principles and Philosophy in Public Policy. Philosophy and Politics. When I learned those courses, I often question myself, why do I have to study this? Okay? Why? Why do I have to learn utilitarian model, Rawlsian models? Why I have to study all this philosophical approach? Perhaps some of you are learning that too now. And you wonder why, right? I wonder why when I studied. And then I'm in the driver's seat of this plane with 11 million people on our journey. Suddenly I realize the importance of that values and the importance of policy based on science, based on knowledge, based on moral principles and value principles. And that's what then make us able to define what is right and what is wrong. Without values, you're only talking about good and bad. You're not talking about right and wrong. It will be completely utilitarian model if you talk about good and bad. Okay?
We're gonna take another round of questions. Prof. Eko. Okay, another one here. Maybe, okay, 1, 2, 3, 4. Very nice. Yeah.
Okay, thank you very much, Pak Anies. Very interesting expositions, and I like the idea, the three components you mentioned, and I guess the success of policy really depends on those three things: component of trust, competency, integrity, and also intimacy. And it's not only in time of crisis, but also in normal times as well. So I have two questions about resilience. So the first one is, we know that people differ in terms of their response towards crisis. So the concept of resilience can be very different for different people. So their action, their reactions would be very different as well. So when we have a policy and we know that the policy is good, unfortunately the impact could be could vary. So some people may not be that much affected, but some others, unfortunate things like the low-income family would be very much affected. So to what extent that we should tweak the one-size-fits-all policy with additional complementary policies to soften the impact on the unfortunate group of the population. The second question is, if we look at the notion of resilience, I mean, there are two different notions of resilience. If you talk to engineers, they will talk about resilience is basically ability to come back to the original state. Yeah. But when you talk about social system, resilience is more complex because there's no guarantee that you're actually going back to the original equilibrium, we call it. It could be another equilibrium which is totally different from before. So it's interesting to me, for us, I think, to see to what extent the crisis and the conflicts has shifted. I mean, in terms of recovery, the original state may not be the state that we were before. So what are the changes that we experience, especially if you look at from the point of view of now, relative to that times before the crisis? Thank you.
Thank you so much, Prof. Eko. Your question really worth writing as a journal article. Yeah, go ahead.
Hello. Hi. Good afternoon, Pak Anies. My name is Kenny. I'm a student here. So I have a question from a more macro governance kind of point of view. So earlier you mentioned in your speeches that that it's important to focus on science, data-driven decision-making process. Yeah. So how important do you think that the person in the driver's seat, the national leaders themselves, should be technical experts, or do you think that it's more efficient to have a team following you, or if not just technical expertise, is it more about something else, that source that should make a good national leader? more technical or something else that you think is necessary? Kenny. Thank you.
Okay, another questions. I think I saw hands in the middle. Maybe a female student. Okay, there's a one here. Yeah, go ahead.
Hello, Pak Anies. So I'm an Indonesian NTU student also. So my question is regarding on the stakeholder management, because I think when you are in crisis situation, you have a lot of different category people that you have to face. For example, UMKM, SME, and then healthcare hospital. So how do you balance your decision to basically make everyone happy? And maybe the additional question is because the COVID is not only in one phase, but there is going up and then it slows down, and then in the next month it can going up again. So in this different phase, how do you see the situation, and how do you make the decision to to loosen up the lockdown, or to make it more strict of the restrictive measure? So yeah, that's my question.
Thank you.
Thank you.
Any female students asking questions, please? Anyone? Oh, okay, there. Yeah, good.
Hello, Papa Anis. I'm Hafida. I'm PhD student in civil engineering. So I have a question about the term of the resilience and then urban resilience itself. So we know we have many terms, fancy standard from IPCC with climate change and so on. But how to translate these fancy words to the other people that lives outer of Jakarta area? Because maybe for them they are not really affected with this climate change in terms of their mind, but although reality it really can affect them. So in future, if you plan to be a leaders in outside of Jakarta or in a greater area above it, so how is your strategy to make them familiarized with these fancy words, standards from the internationals? Thank you.
Okay, so we have 4 questions. The last one, can you repeat? Elaborate a little bit. Give examples. Can you use microphone? Yeah.
Yeah. So for example, we have a lot of international standard from climate change standard from IPCC
okay.
and so on. So many regions in Indonesia, like for example, my grandparents in Yogyakarta, they don't really understand about climate change and the effect.
I see.
But we need to implement this climate change effect in the master plan of cities or on the regions. And how do you, make them also be aware of this kind of important changes in the future, although maybe it's very fancy for them.
So basically, you're asking the standard measurement for resiliency.
Yes. Yeah.
Okay, got it. Yeah. That's a very engineering question. Okay.
Let me address the last one. I'll go back in reverse. When it comes to big ideas, big challenge such as climate change, that is complex indeed. And when you tell common household families about climate change, the most likely response would be, okay, so what? What should I be doing? I think our responsibility is to convert that into actionable, practical measures to be taken at the city level, at the neighborhood level, and at the individual household levels. So, for example, buildings contributed about 30% of greenhouse gas emission worldwide. And air condition is also a contributing factor to that. So translating that into actionable feature at home is key. Setting up your temperature, duration of your usage of air conditioning, for example, at the household level. And then you're talking about garbage management. Yeah, you divide your sorting out, you sort out your waste, sorting out your waste, reduce your waste, and then reuse, and then recycles, and then sorting out. That is all done at the practical community level, individual levels. So if we just translating as it is, the big principles, then it is definitely difficult to adopt. But when you translate that into something actionable at the individual level, at the family level, the community level, then we will be able to see that change. I'll give you one example. Jakarta experience problems of air pollution through motorized vehicles. And our approach is that we will reduce greenhouse gas emission in Jakarta by 30% in the year 2030. So then we break it down into actionable programs. And when you break it down into actionable programs, communities, individuals are able to do what our target is aimed at, and converting the public from using private vehicles into public transport. You translate that into action that individuals is willing to do it. Integrated ticketing system, integrated route system of public transport, then to ride public transportation becomes something rational. You don't have to be altruistic to ride public transport, because if you ride public transport, economically it's more efficient, and then in terms of time, you also save times, save money, and convenient. So you can be rational in adopting such a noble purposes of reducing greenhouse gas emissions. So that's one example. We need to translate that into something actionable, and that people adopting it and thought it is a rational choice. If it is not a rational choice, then people will not do it. Questions on UMKM, small businesses. I will address this with the questions of Prof. Eko at the same time. But with regard to how do you make decisions of more restrictive or less restrictive, listen to the experts. Epidemiologists, they have the numbers, they have way of predicting. Listen to them. Don't use your instinct, because your instinct doesn't work. You have no previous experience of dealing with this, so you never actually build instinct on this. Listen to the epidemiologists. So the epidemiologists, we are receiving report from epidemiologists on daily basis, and every week they will give us recommendation on what to anticipate in the following weeks. And based on that, we make decisions. And whenever we are losing up our restriction or restrictive measures, whenever we are losing it up, we always tell the public there may be a time that we have to pull what we call emergency brake. So let's open up, let's relax a little bit. But if things getting worse, we will have to pull emergency brake. Who decide when to pull emergency brake? It's the people that actually decide. If contagion continues, and because of people interaction, then we have to pull the emergency brake. So it's not us wanting to pull the emergency brake, it's everyone's behavior in an accumulated way that forces authority to pull the emergency brake. The readers were all the scientists, the epidemiologists. With regards to small businesses, and this is also Prof. Eko, with regard to resilience groups. And your first questions, some experience positive impact, some are experiencing negative impact. And I remember in October 2020, so it was about 6 months after the outbreak in Jakarta, we had to decide minimum salary for 2021. The decision is in October because company will be using that decision in January. So they will be using on their planning in November and December. And it's on the hand of the provincial government. This is the time where we adopt a policy that is not recommended by the law of the national government. We adopted an asymmetric approach to minimum wage, and never happened in Indonesia before. What is asymmetric approach? Because the crisis is like a K-shape. Some were going up, of some industry were going up, some industry were going down. Why should we then lower minimum wage for the industry that actually experiencing an expansion? Look, healthcare industry, we're going up. Factory of masker, factory of, all this medical equipments, we're actually experiencing a booming. Why should we adopt a lowering our minimum wage? So we adopted that. The central government was not too happy with that decision, but we thought, it's the right thing to do. We cannot just adopt symmetric approach to all problems. So we adopted asymmetric approach. This is where on that diagrams, good but wrong in a way. Because when you look at the restrictive measures, it doesn't look like you're following rules and regulations. But the reality is asymmetric impact of that. Now, the second is small businesses, is this. How do we go back after this? There is a silver lining that we didn't realize before. This is what happened. We have micro businesses in large number in Jakarta, small businesses. They are selling food, the street food, the street vendors, and then you have these families producing bakeries and then being distributed in their neighborhood. When everything has to close down, their business stops. Now, what still continue is the online transaction. Unfortunately, all the small businesses were not participating in the marketplace, the digital marketplace. They're not in that digital marketplace. So our strategy is let's get them on board of digital marketplace. By doing what? We are giving two things. One, it's called IUMK, Izin Usaha Mikro Kecil, business permits for micro and small businesses. We're giving it away. We're coming into small businesses and asking them, do you have permits? And they said, no, I don't. Then we're giving you permits. Basically, we're giving away permits. Number two, we're giving away tax ID and PWP. We're giving away. Because with that too, they can register on the digital marketplace, and suddenly they don't have to rely on their neighborhood markets for their businesses, but they can get orders from anywhere in the city. So Jakarta had only 58,000 small businesses permit in 2017. I'm sorry, in 2020, at the beginning of 2020. after this crisis, we had more than 250,000 small businesses permits. And all these 250,000 were able to take orders online from anywhere in the cities. That never happened before. Let me give you an anecdotal experience. I stopped at the warung kaki lima, street vendors selling pecel lele. Pecel lele is a typical kaki lima. So I ordered the pecel lele. If some of you were kangen pecel lele. And then I waited for the pecel lele to come, and it never came up. I waited, and then finally I asked my assistant, please check to the owners, where is my pecel lele? And then the owners came to me and said, Pak Gubernur, my apologies. We have lineup of online order that we need to service, and all this ojek, the online ojek parking next to it. I thought it was Pangkalan Ojek. Pangkalan Ojek is the ojek station, because there's so many ojek there. Apparently, those are waiting for delivery of this. So the impact of this crisis that we're giving it away is something of new also to us. So now, after the crisis, Prof. Eko, we rearranged our zoning regulations, and it was timely because in the year 2021 and 2022, that was the time in which we are revising our RDTR, Rencana Detail Tata Ruang. Just after the pandemic, so we are able now to adopt a zoning regulations that will allow resilience of a community. In the past, if you have an apartment complex, you allow a property developer to build apartment complex, you don't require them to build health facility, you don't require them to build schools, you don't require them to build groceries. But now, given that, if it ever happens and we have to close down the communities, these communities still can function. There are few examples in Jakarta where it is already there. One example is the Rasuna area. The Rasuna area, when they're experiencing a lockdown, they still function. The malls is there, all the stores is there. As long as the community is kept within them, they can continue to function. So we have revised our zoning regulation according to this crisis. Kenny, on the technique, you have to combine some technicalities, some generals. You cannot just have one. You have to have both. And I must say, you have to have individuals on your team to do benchmarking to others who have experienced similar crisis before, and pick up some lesson learned. And always do a multi-backgrounds discussion session so that we will be able to hear different perspective before a decision is made. Okay? Thank you.
Thank you so much, Pak Anies. For the last round of question, I would like to use my privilege as a moderator to ask question. Okay, so there's one course that I'm teaching here, Pak Anies, which is Sociology of Risk and Crisis. A shout out to my students. Ooh. So they're really happy that you're here because in this semester they're learning about crisis, different kind of crisis. And I have two questions for you that perhaps you can answer and maybe explain to my students and everyone else here. First is, how do you define a crisis? The second one is, how do you know when a crisis is emerging?
I'm not aware of the literature, so this is more of a experience-based response. So when our resources were stretched out, then we're facing a crisis situations. When your resources is still able to cope with the problem, then it is not a crisis. That's from my experience in Jakarta. So, for example, when we have diseases and our hospital capacity meaning equipments, meaning human resources, is still able to handle, it is not yet a crisis. But if our hospital no longer able to handle, then it is a crisis, definitely. Same thing with other things. So look at your resources, and if you don't have capacity, then we are facing a crisis. I think we can see that in other area too. And then number two is something that is unpredictedly happen. Then we may be facing a crisis because we're not prepared, even though we have resources. But it happens at times that requires effort immediately. Give one example. You have a high-rise building on fire. That's a crisis situation. We have a capacity to handle the fire. However, it wasn't planned. I mean, there is no fire on our plan. So we're facing a crisis situations. So that's the kind of answer I would reply to you when it comes to crisis situations. And that's why it is important when you are in leadership that you uphold key values and define what is your values when you're managing large city, when you're managing large organization. Let me give you an illustration. If I manage 5 individuals as a leader, I will tell everyone this is the task you have to do. A, this is 1, 2, 3, 4 you have to do. Person B, this is the task. Person C, these are the tasks. D, E, and so forth. 5 individuals. I can define what needs to be done. If I manage 100 individuals, I created SOP so that these 100 individuals will operate according to the SOP. But if I manage 180,000 employees, okay, I cannot create SOP for all of that. I'll tell them values. These are the values. The leaders of 100 individuals translate that into SOP. The leaders of 5 individuals will translate that into task. So the top leadership outline values. Number 2, the leadership outline what are key objective to be achieved. What are key measurement to be achieved. And with that, the entire organizations will then look at the values, look at the target, and look at the parameters. Then the organization start to work. Now, when you face crisis, you have to identify what is important during this crisis. So when you tell everyone the important key or the important matters is saving life, that is number 1. That's your values. Then everyone will follow that. But if you tell everyone, let's balance now, saving lives and saving money now, then people will have limbo. There is a time that you have to decide which is your priority. As time goes by, you make adjustment. Now it's time to balance. And then when the crisis started to be under control, then you put, okay, now recovery of the economy is the priority. But you have to really set that values, and then people, individuals in your organizations will follow. I hope I answered your questions.
Thank you so much. Any other 1 or 2 questions? Okay. Another one here and another one in the middle. Okay, these are two last questions before we end the lecture. Very quick.
Yeah, hello. My name is Indah. I'm a PhD student from History Education at NIE, and I have very quick question. Previously, Pak Anies, in response to Prof. Digantada's question, you mentioned about the financial and food assistance for those from the underprivileged in Jakarta. And my question is like, was those assistance for people with the Jakarta KTP or ID card, or did you also include the non-Jakarta KTP who live in Jakarta? Because so many workers come to Jakarta outside the city and reside within the city for works. They also receive the assistance from the provincial government. That's my question. Thank you.
Thank you. Another question in the middle. Make it very quick, please.
Yeah, so it's very quick. Hi, I'm Chris, year 3 from NTU, born and raised in Jakarta. Yeah, very quick question. Thanks for sharing all the things that we can learn about being a leader. I think a lot of hikmah that I can learn from you. What about the things that you felt you could have done better when handling COVID in Jakarta? Yeah, thank you.
Two very good questions, Pak Anies.
Bu Indah, you talk to officials in Jakarta, ask these simple questions, your questions, they would say, will help everyone. Because Pak Gubernur never say, priority is to help Jakartans. No, it's to save life. It doesn't matter what is your KTP. Look at their eyes and this is our sister and brother. Admit them, help them. Done, period. Will cover the cost. This is time of crisis. This is not the time in which you're talking about distinguishing services for Jakartans or non-Jakartas. All of them need support, and we have been doing that. Our ambulance picking up patients from outside the border of Jakarta. If they call our number and they ask for transfer services, we pick them up and we bring them to Jakarta. Yes, it's an extra effort, but it is a time of humanitarian crisis. So we have to do our best to save lives. And this approach is also similar to even at the time of no crisis. In Jakarta, after Lebaran, we used to have what's called Operasi Justisia. Pak Sebastian maybe remember this Operasi Justisia. Pak Eko remember when people were coming back from Mudik, they bring in their families along and move into Jakarta. And then our staff, for years and years, were doing screening in bus terminals, in train stations, and identifying anyone without KTP Jakarta, will put you on a certain room and will send you back to your region. And we have been doing that for years, and it has become a habit that no one thinks this is not right. Okay? Beginning of my service in Jakarta, I said, stop this, we should not continue doing this. Anyone born in Indonesia have every rights to move into any place in Indonesia, because this is one country. This is not coming in from a different country. And Jakartans has been growing like this because of migrants coming in from outside. Not only because of the native Jakarta only, but migrants are coming in. Why should we stop new migrants? And a second issue is we're discriminatory on that. We don't do screening at the airports. We do screenings at the bus stations. We do screening at the train station. What does it mean? It means if you are among the haves, welcome to Jakarta. You can fly to Jakarta, we welcome you. But if you are coming in by bus, you're coming in by train, we will screen you. We were being discriminatory and we didn't realize it because it's been a practice of so many years. We stopped that. And I do hope, 2 months from today, we don't see it again. Okay? Because I'm afraid that policy may not be continued. We may be seeing a reactingment of this policy of, restricting people from moving in to Jakarta. Never worried about fiscal burden, because whoever come in, they will be productive in our city. They'll pay tax. They'll contribute to our income.
Let's go, Stan.
Last questions.
In retrospect.
What could have been
Yeah.
better? It could have been better if local government, national government, and neighboring government were having same paradigm, same set of priorities. I wish it was there. We had synchronized priority only at the beginning of 2021, a year after the outbreak. Beginning in the 2021, the approach is sync between national approach, Jakarta approach, and the neighboring area approach. Since then we can handle the COVID better. And I often give this analogy to our team. If you're riding
Horse cart.
horse cart,
Yeah.
if you're riding a horse cart, kereta kuda,
Chariot, yeah.
horse carrier. If you're riding a horse carrier, you can have 8 horses on your carrier. Who define the speed of the carrier? Not the fastest horse, but the slowest moving horse. Okay? So if these 8 horses were not sync, then it's the slowest that determine the speed. And when you're handling COVID, it doesn't matter how progressive you are. If others were not as progressive, then it is never effective. So this has to be synced, and I wish that could have been done better. Okay? Terima kasih.
Thank you so much, Pak Anies. It's been such an enlightening talk that you have given us, and we learned so much from your own experience as a leader and the governor of Jakarta. And this is something that my students and all of and then everyone else here will remember as something that they can learn for their future. And unfortunately we ran out of time, and on behalf of NTU, I would like to express our gratitude to Dr. Anies Baswedan, and please join me in thanking Dr. Anies Rashid Baswedan.